First time because he says the country is wasting time to develop a national plan to save lives from COVID-19. Bright recently led BARDA. That's a key agency created to defend the country against outbreaks. And he says he was removed from his job for putting science over politics. And he filed a whistleblower complaint earlier this week. And today, a federal agency found reasonable grounds to believe that the administration was retaliating against Bright. Well, tonight, a preview of our wide-ranging conversation. The president called you a disgruntled employee.
I am not disgruntled. I am frustrated at a lack of leadership. I am frustrated at a lack of urgency to get a head start on developing life-saving tools for Americans. I'm frustrated at our inability to be heard as scientists. Those things frustrate me.
As early as January, emails show he was sounding the alarm, first about the critical shortage of N95 masks.
We see too many doctors and nurses now dying. And I was thinking that we could have done more to get those masks and those supplies to them sooner. And if we had, would they still be alive today? It's a horrible thought to think about the time that passed where we could have done something and we didn't.
Bright claims his persistent warnings caused tension with his bosses at the Department of Health and Human Services. It reached a breaking point when he raised concerns over the administration's embrace of hydroxychloroquine, what he called a drug unproven to treat COVID-19 patients. You believe you were retaliated against because you raised concerns about hydroxychloroquine?
Yes, I do.
And says he was surprised to learn he'd been reassigned to the NIH to develop diagnostic testing. You'd been sounding the alarm about the lack of testing platforms. This sounded like an important job.
That's an important initiative. Norah, I'm the director of BARDA. To take me out of our organization focused on drugs and vaccines and diagnostics in the middle of a pandemic, the worst public health crisis that our country has faced in a century, and decapitate the BARDA organization to move me over to a very small, focused project of any scale, of any level of importance, is not responsible. Didn't make sense. Tonight, a spokesperson for HHS says this is a personnel matter under review, but that they strongly disagree with the allegations and characterizations in Bright's whistleblower complaint. You can hear more from Rick Bright. That's on Sunday, May 17th on 60 Minutes. Tonight, a mother in Georgia should be celebrating